It's often said that disability is not inability. With the implementation of inclusion policies, many individuals living with disabilities have been able to work and access essential medical services. For instance, those living with albinism have been able to access sunscreens from public hospitals. Article 27 of the Kenyan Constitution also bars discrimination against those living with disability. My name is Belden Waliaula, and on this edition of Health Watch, we focus on stories of individuals living with disabilities and how they are overcoming social norms. In a world where disability knows no bounds, Elizabeth Wanjiku Nderitu stands as a testament of resilience. A tailor and entrepreneur, she balances her craft with caring for her two children. One of them is Confidence, who was born with albinism. Although the father was shocked at first, he would later come to terms with it after counseling. But Elizabeth says this didn't come as a shocker since her elder brother also had a daughter with the same condition.
Confidence ni mtoto mwenye ni mtoto active. Hata kwa shule nilipompeleka, mtoto huyu anakuanga anaelewa kila kitu, anasoma vizuri, na hata walimu wenye nampelekea wanamfurahia.
Wanjiku says her son's albinism has not hindered him from achieving anything, as he is jovial just like any other kid. Having a child living with a disability comes with its challenges and complexities. However, having a disability card has enabled her son access a free sunscreen.
Nilipatana na mama mmoja hapa Karatina ako na mtoto kama huyu, na huyo ndiye niliulizia. Akaniambia venye kunaenda, kunakuwa na hata kwenda registration ili nipate kitambulisho ya huyu mtoto ya disability, na wakanichukua wakanipeleka pale Karatina Hospital, tukaenda tukasajiliwa, na after few months nikaletewa hiyo kadi ya disability. Na hiyo kadi ya disability imekuwa imenisaidia, ilikuwa yani inanisaidia kwa kuwa kama sunscreen huwa napata.
Since raising a child with disability comes with an extra financial burden, caregivers have been empowered economically by the National Council of People Living with Disabilities, NCPWD, to care for their kin without sinking into poverty.
Kwa upande mwingine, National Council imenisaidia. Kwa kuwa wamefanya nifike hapo nimefika, wamenisaidia na kunipatia hii sewing machine. Hii niliitiwa pale kwa national ofisi yetu Nyeri, nikaenda nikakuja nikapatiwa hii machine, na ilikuwa na kila kitu mpaka pasi, niko na pasi. So nikishona nguo hapa naendanga na connect hiyo pasi kwa nyumba, na hiyo nanyorosha nguo inakuwa sawa.
Despite this, getting her son a school was an uphill task. Most schools were reluctant to admit her son.
Nilipoenda kuulizia huyu mtoto shule iko hapa public, nilienda alipofanya interview tukaambiwa mtoto ameanguka, na tukarudi kwa mkubwa wa shule tukamuulizia huyu mtoto tulikuwa tunataka ajoin hii shule. Akatuambia huyo mtoto wenu ako na ulemavu, mnafaa mpeleke shule ya walemavu, na tukaambiwa tumpeleke Madhaizi special, Tomotomo special, ama igine iko na hapa Ihwagi, sijui ni ya nani. Tukiangalia tukajiuliza, Madhaizi special ni ya mento, Tomotomo ni ya bride, ni ya bride. Ni aje mtoto wetu na hana shida na anasoma vizuri.
The country in general has very limited special schools, making most people living with disabilities unable to access quality education due to fewer learning centers and resources.
We are also in need of teacher aids, because most of these learners, when they come to school, they really need to be assisted. Some in toilet training, others in feeding, and we really need teacher aides who can be able to assist the teachers so that these learners can be able to get these skills.
Therefore, there's an urgent need for expansion of educational facilities that are friendly to persons living with disabilities, together with the specialized training for teachers.
I would appeal to our government to build more schools. Like now we find in Teto, we only have 2 schools, and we don't have any special unit. So for the schools who cannot be able to board, they do not have schools where they can be able to go and learn.
Leah Njeri Mugo is a librarian by profession living in Nakuru County. She has also been a beneficiary of free sunscreen. She explains why it is important for people living with albinism to have access to these products.
We always take sunscreen from the Nakuru Provincial General Hospital every month, and we have been having skin cancer screening once in a while. So I always get an opportunity to go there for checkup, because the checkup is done by different doctors who come to check on us.
She has been able to inspire more people like her to soar to greater heights by beating the glass ceiling.
Working at this place has enabled me to reach to many, because when they see me working normally, they see me doing my duties normally. When I'm given a task, I complete at the required time frame. So I think I'm not able to tell them, but they can also see with my actions.
The National Council of People Living with Disabilities also has a career portal that updates its members on available opportunities. The skilled ones can now get employment or engage in economic activities apart from reskilling and upskilling.
I would advise employers to give us a chance. They should not look at the disability, they should look at the capability. We are able. Apart from me having albinism, I can be able to do anything that any other person can do.
These PWDs are well abled like everybody else. And as a country, as a nation, we are supposed to include them in all our programs. We are supposed to, like now in Kenya National Library Service, we have inclusivity when it comes to employment.
In Nakuru County, people living with disabilities have taken the initiative to empower themselves economically. Those living with visual impairment have this posho mill set up for them. They run it together and share the proceeds that come from it, thus empowering each other economically. Despite them being visually impaired, they operate and run this posho mill with ease.
Lakini nilipojiunga na hiki kikundi, maisha ikawa sasa inaenda ikifanya nini? Ikiwa rahisi kidogo, kwa sababu tukiwa pamoja tutaweza enda mbali. Na ninafurahia kwa vile umoja wetu ndio umetufikisha mahali tulipo.
Michael Kaburu, the Disability Services Officer in charge of Nakuru County, says issuing group grants to those living with disabilities has been a game changer. This group, called Wanyororo B, received the first grant of 300,000 shillings from the council, and they have been growing ever since.
We are rolling out various programs under the National Development Fund for persons with disabilities. This being one of them, these group grants, where we have groups like Wanyororo B who are doing extremely well with the income grants that the council offers and supports them with.
In Nandi County, the council has focused on seeing those living with disabilities finish their education and also get employed in the process.
We support persons with disabilities with the economic empowerment. That is one of the programs. We give scholarship to students from Form 1 to Form 4 and even at the university level.
But right now we've moved to scholarship program. Each year we support about 250 learners with disabilities for full 4-year scholarship, and 94 each year, 2 from each counties for poor parents with disabilities, their children, for a scholarship. Actually, when we get more funding, we are in the plan to double even that number.
The self-help groups in the county have invested in dairy farming. They now have 4 cows in total and benefit from selling milk.
Tumekuwa na project na tumenunua ng'ombe. Tuko na ng'ombe sasa 4. Tulikuwa tunaanzia 3 lakini imeongezeka kwa 4. Na sasa na pia tuko na plot.
Those registered as people living with the disabilities have been receiving cash transfer stipends from the national government, which has also been beneficial in improving their livelihoods.
As from 2012 ile hii program ya cash transfer iliingia, imemsaidia sana. Sababu hapo ameweza hata kupata at least every month something. Tunamnunulia madawa, tunamnunulia chakula. Sababu mtu kama huyu sasa kama amelala anahitaji chakula ya well balanced diet. Also imemsaidia ikikaa, kulikuwa na wakati hiyo pesa inakaa kwa muda, ikikuja inakuja as lump sum. Alafu kuna wakati ilifika tukaanza kununulia hata ng'ombe.
Inclusion of people living with a disability in schools, workspaces, and even in the community has improved, with most schools and employers now being accommodative. This is thanks to social awareness campaigns backed by legislation.
We have enlisted ourselves on e-citizen platform. So now the client or the person with disability across the country, they don't need to go to our offices. They don't need to come here or to our county offices. Once they are through with the medical assessment at their own health facilities within their own counties, all they need is just a smartphone, internet connection, that medical assessment form, their national ID, a passport size photo, and maybe for minors will be registered for by their parent, guidance, or caregivers on their e-citizen platform. And within 10 days, they get their registration certificate.
However, the struggle is not over yet. Hence, not yet time to pop the champagne. More needs to be initiated and implemented to achieve the 1975 Declaration of the Rights of Disabled Persons as engendered by United Nations General Assembly Resolution 3447.
That if someone with disability is earning 150,000, is exempted from tax for 5 years, though we are working around that regulation, how it can be permanent once and for all with a relevant entity like KRA and the National Treasury. Issue of importation of a car, if disabled people can afford, the import duty-free, the quota of 5% employment, and many other affirmative consideration, including participating in legislative agendas in this country through nominations.
Belden Waliaula, KTN News.